Okay, so welcome everybody to today's video, Advanced Care Planning Made Simple, and welcome to Claire Fuller, who's sharing her knowledge and experience of advanced care planning.
Well, thank you so much, Carol, for inviting me. I am really looking forward to our discussion today and sharing something I'm so absolutely passionate about.
Well, thank you. It's really good of you to give your time. So I just thought I'd say a little bit about your profile, Claire. So Claire's a registered nurse with 30 years experience in end-of-life care. She's worked in hospices, the community and acute care sectors as a clinical nurse specialist and at national level as a consultant nurse for the Gold Standards Framework. Claire is a CQC specialist advisor for end-of-life care too, and also a lasting power of attorney consultant. So amazing experiences there. Claire is also the founder of Speak for Me, which helps organisations to improve end-of-life care and provides professional and public education about palliative and end-of-life care and advanced care planning. And Claire also campaigns for proactive advanced care planning. She hosts a wonderful podcast, Conversations about Advanced Care Planning. And I've had a look at your website as well, Claire. And I wondered if you just wanted to start by highlighting some of the fantastic resources that you've got on your website and podcast for the viewers before we get into talking about advanced care planning.
Oh, that's really kind of you, Carol. And I have to say the website is continuing to grow, and after meeting you, may even contain a YouTube section one day. So you're inspiring me. So the website sets out the services I offer, obviously includes the lasting power of attorney consultancy and advanced care planning. For organisations, I describe the support I offer for improvement in end-of-life care and for education. What I'm most proud about is the resource section, Carol, and that is developing day by day by day. So the resource contains the blogs that I write, and this will be, this will be of interest, I hope, to your listeners, because quite often people come in with questions that they want to ask me about advanced care planning, and I'll answer them through a blog.
Amazing.
I'm so sorry.
Don't worry. If you need to get any water, I've got some here because I've had a terrible cough as well. So
let's have a quick drink.
Yeah.
That's the excitement with early morning recordings, isn't
it?
The voices are just getting woken up for the day.
Yeah.
So the blogs often ask questions, and a quite recent one came in from a nurse in the community, which I was able to answer, about advanced decisions to refuse treatment and lasting power of attorney. The resource section also contains the podcasts, which you've mentioned. I'm so proud of the podcasts, and they address a different matter about advanced care planning because people think it's one thing. And I'm up to episode 75 so far, showing the huge elements and the huge components of advanced care planning. And I've just recently added to the resource section the events that I run, and everyone is more than welcome to attend the free monthly webinars that I run, all about advanced care planning.
Oh, that's wonderful. And it's a really good resource, not just for, because I have a lot of students and newly registered nurses that watch my channel, but anybody sort of looking at end of life in any field, the resources are there for experienced nurses as well, aren't they? Yeah.
I would actually broaden that out, Carol, and say the resources are there for everyone, because my mission, if you like, is to try and, yes, improve professional understanding, yes, raise public awareness, but also normalise these important conversations. Yeah. So I say, if you're mortal, if you belong to the Mortal Club, then this website is for you.
Yeah, so do check it out, everybody. And wonderful for module leads. So I'll promote it to module leads actually as well when they look, because they look at end of life as part of modules. So I thought my first question, Claire, is because I get confused. I know when we met before, I was a bit confused with some of the terms, and I'm not a palliative care nurse or oncology. What is advanced care planning, and is it advanced or advanced? So what's the difference between advanced care planning and an advanced care plan?
That's a great question to kick off with, and it really helps to set the scene, I think. So I think often if we hear the word advanced, especially in our clinical practice, we tend to think it's something quite complex, don't we? It's an extra skill that we've learned after we've qualified and after we've registered. We learn those extra advanced and highly complicated skills. Whereas if we just strip it back to the word that it means, advance, without that little d on the end, it means thinking into the future, which really softens the idea and makes it appear, I don't know, maybe a little bit less scary. I don't know how that sounds to you.
Yeah.
But advance is simply thinking about the future, whereas advanced can sound a little bit scary and crikey. I need a lot more skills to be able to do that. So first of all, it is advanced without the D on, not advanced.
Yeah.
And then the second question you ask is great as well, Carol. So you asked what's the difference between advanced care planning and an advanced care plan. And we could spend our whole hour talking about terminology, but just as a brief overview, advanced care planning, if you think about it as a whole umbrella, includes so many different things. So it could be thinking into the future and thinking about something as simple as organ donation. It could be thinking into the future and thinking about a will. So all the things that are so normal to so many people. What may be the output of all these different discussions is to generate and create an advanced care plan, a document from these discussions. And quite often towards the end of life, the later stages of life, it will be formulated into a more localised plan. Does that help and make a little bit of sense?
It's really good overview actually, and really clearly explained, and you've also got all those resources as well to sort of look through, haven't you? So thank you for that. So sort of on that part, what advanced care planning guidance is available nationally? Is there any nice guidance? You know, because a lot of students are looking at assignments, for example, as well, but what guidance is there out there?
Yeah, and I think it's really important to talk about this as well, because it truly embeds it into everybody's role, into every generalist role as well. It's not, as I keep saying, this optional extra or a specialist role.
Yeah.
So NICE is really clear, Carol. It really embeds it in all of our practice. And there's a few, maybe a couple of guidelines that might be of interest and use to your listeners.
Yeah.
So the first one that I'd draw attention to is the NICE guidance for end-of-life care for adults. That's QS 13. I guess we can put links into the show notes as well for all of this.
Yeah. You just can't mention, you can't state a link on YouTube because it pulls them off YouTube, but you can just, I can put them in the description. Yeah.
Perfect. Thank you. So that guidance contains 5 quality statements. It reduced from I think it was 16 some time ago.
Yeah.
But it contains just 5 quality statements, and out of interest, the second one down is advanced care planning. So when we're looking at meeting our national guidance, that is set up there, that is set, that is something that organisations are expected to do. The second one that I'd like to draw attention to is end-of-life care for adults service delivery. That's 142, and that contains 12 key recommendations. And the one that I draw out from that is number 6. And guess what that says? That says advanced care planning. It really is woven into the service that we provide people, everybody, absolutely everybody. And I guess we always do things in 3, don't we? So the third one I'd like to draw attention. It's not NICE guidance, but lots of people will be familiar with the updates and the changes and the developments across the NHS. And services will be aligning to what's called the ambitions framework for end-of-life care. And that contains lots of information about honest conversations. And I was interested at your YouTube channel, and you've got a section on personalised care, haven't you?
Yes, yeah.
And this is all about, this all brings into that beautiful, rich, personalised care that you talk so passionately about as well.
Yeah.
I think the other guideline or legality that we have to sort of nod to if we're talking about advanced care planning is to be aware of the Mental Capacity Act as well. So there are a couple of elements. Hopefully we'll chat about those in a little while, but there are a couple of elements that do draw down on a legal framework as well. If we're talking about lasting power of attorney or advanced decisions to refuse treatment. And it's important that people are aware of the principles of the Mental Capacity Act, because that will guide and direct some components of advanced care planning. So there are, well, I cheated, didn't I? I said there were 3 guidelines, but I've given 4.
Yeah. So if students or newly registered nurses had questions, because you're the expert in this, I would say go onto your website and you answer questions, don't you, for like students and newly registered. Is that okay, Claire, to say that?
Absolutely.
Because I'm just thinking if we get lots of questions about power of attorney and stuff like that, I wouldn't want to answer them. I wouldn't be the expert in them. So, you said at the start about your website and your podcast. So you've got this amazing resource. That's fantastic. And that's so helpful to for students with assignments as well, post-registration and undergraduate, with those key documents that you've highlighted. So thank you very much for that, Claire. So my next question is, how would all of this relate to a student nurse or an early career nurse whose job may be to approach the subject, or a patient starts approaching the subject of advanced care planning?
Okay, and I'm going to go back to the beginning again and say it can sometimes feel daunting. I don't know if you find that from your students.
Yeah.
If you said, well, I don't quite know where to start.
Yes. Yeah.
It feels scary.
Yeah.
So the first advice that I would give to a student nurse or a newly registered nurse would be to listen to cues. Listen, and I know there is so much emphasis placed on communication skills throughout training as well. So it really is rooted in listening to what people want. And the most simple information I can give, Carol, is to listen to what matters most to a patient. Now, if they tell you what matters most, for example, might be to get home, that provides the building block for all of your advanced care planning. Advanced care planning is never about getting a piece of paper or a form and approaching a patient or a person with a tick box exercise. It's about using our ears and listening to what matters most. And patients will drive the conversation. So it's most basic level. It's about listening, and all of us, that's what we do as good nurses, don't we? We listen to patients. I would also advise signposting as well. We don't need to be experts in everything, but we do need to be knowledgeable about where to send next. And know the resources that are available in your local area, know where to signpost, and have the confidence to ask if you're not sure. Signpost people on. The next piece of advice I would give is to be really aware of what information is available locally. There isn't an overarching national document that I can point everybody to. So I would really recommend that people have some awareness of what is available in their local area. Thinking of, I don't know, it might help. Would it help to talk about novice to expert role as well?
Yeah, whatever you think.
Yeah. So I know we also think about progressing through, don't we? Sort of starting with a basic level of advanced care planning. We'd almost draw in elements of novice to expert in this as well.
Yeah.
So thinking about that novice level, I would suggest it's about creating an awareness, being aware of advanced care planning, and understanding an overarching framework of advanced care planning. Maybe that advanced beginner, we're looking at beginning to gain a little bit of confidence in signposting, and alongside those really rich improving communication skills, supporting through a bit of theory and practice. I was thinking about competent as well. What would competent look like? So again, gaining confidence in conversations and translating those into more tangible plans that we spoke about earlier.
Yeah.
Able to signpost locally and nationally. Proficient, I was thinking about this. This challenged me. I'm thinking about more advanced care planning. It might look like something around conversations around advanced decisions to refuse treatments, and really drawing down into the more complex levels. What would an expert look like? And I would say I don't include myself as an expert yet. I would say I'm still learning. But what I'm trying to do is to improve my knowledge through attending maybe the Open Justice Court of Protection projects, to hear law tested in action and then translate that back into my practice. So does that help give a sort of building block from novice to expert for advanced care planning?
Absolutely. And it sort of links to my next question, is what does someone junior or newly registered do if they think somebody needs one? And you were sort of saying about signposting, but just to be aware, there is a team of people usually with the employer. So do you want to sort of give us a bit of an answer to that? What do you do if somebody needs one and you're junior? It might not even be junior, it might be something that you haven't come across. It could be in any area, like you say. Any advice there?
Yeah,
which might be similar, but
they will overlap, and we're going to keep sort of going back to similar things, but it's really important. It is perhaps an opportunity to draw out with some examples and maybe clarify what we've been talking about.
Yes.
So if somebody needs an advanced care plan, I'm going to say again, it is individual and it is person-centred, and it will depend on where that person is in their life and in their illness journey. So let's think about somebody who is maybe 18, 19, and they've just started to drive. They're just an ordinary person. They may start thinking about advanced care planning, which is simply, as I've mentioned before, something like organ donation. And in fact, one of the podcasts I created was following the story of a young lady that heard about organ donation at 14, chatted to her mum about it, and then incredibly sadly was involved in a catastrophic road accident. The young lady called Fee did die, and her mum knew what her wishes were. So even that's an example of advanced care planning at a very, very young age. So in that case, it's simply pointing to the organ donation site and being aware of our opt-out law that changed as well. So having that knowledge of law and having awareness.
Can I just say the podcast, just state the podcast again if someone's come in the middle of the video, because that would be amazing for students to listen to, wouldn't it? It's Conversations About Advanced Care Planning podcast.
Yes, Conversations About Advanced Care Planning, and that particular episode features the experiences of a mum and her daughter called Fee as well.
Yeah,
so it's a very important episode. Yeah. I'm incredibly proud to have produced that one.
Yeah.
A lot of the people listening to this video, Carol, I imagine will be caring for people with life-limiting illnesses. And we know the demographics of population is changing. People are living longer with multiple comorbidities and complex health issues.
Yes, yeah.
So somebody with a life-limiting illness, we're starting to get into the more of an output of an advanced care plan. Let's think of somebody that may have a dementia diagnosis. If you're chatting as a nurse to somebody that has a dementia diagnosis and you're starting to think about how the disease might progress, it's important to know about something called a lasting power of attorney, so that we can be advising our patients that it takes 20 weeks, can you believe, to register a lasting power of attorney.
Yeah.
So maybe an advanced care plan for somebody with a dementia or with a neurodegenerative disease could look like pointing them in the direction of a lasting power of attorney. And that would be a really important output for their advanced care planning process. I'm going to move us on a little bit now to what we more typically think of an advanced care plan. And you mentioned at the beginning of our chat, end of life care. So I'm going to move it on a little bit to thinking about advanced care planning for somebody who is potentially in that last year of life. And I don't know how many people would be completely shocked if I was to say how many people in an acute hospital are in the last year of life. And the Clark paper, I think it was the Clark paper way back in 2014, told us that around about 30% of people in an acute trust, in an acute hospital, will be in that last year of life. So
I didn't realise it's so high.
It is so high. And then think about different wards that your listeners would be working on, potentially care of the older person's ward, medical wards. That stat will go up even higher. You've got people listening that are having placements in care homes, nursing. You're looking up to around about 80% will be in that last year of life. So this really does matter. So if we're talking about advanced care planning and moving on into the later stages of life, which is so many people that people are looking after.
Yeah.
What are we thinking about? So if we're thinking about that last year of life, this is where we would be really drawing into advanced care planning, finding out what matters most to a person, potentially creating a statement of wishes and preferences. What do I want? I often make people chuckle when I say, what do I want? If I knew my time was limited, my cats are really important to me. Having my cats in my bed, in my own home. I gave birth to my children at home. I'd like to jolly well die in my own home as well. So that's that sort of thinking, and I've had those conversations with my family. Thinking about towards the end of life as well. If you haven't got a lasting power of attorney in place, I've mentioned it'll take 20 weeks to do. That needs to be done. If you're thinking somebody could be approaching that last year of life, certainly a lasting power of attorney ought to be formulating part of an advanced care plan. If your patient says to you, there is no way that I would want that treatment, maybe they've got something like MND, motor neuron disease, and they've heard about feeding tubes, they've heard about breathing masks as well, and ventilation, and they don't want it. We need to know that people can refuse an advanced treatment through an advanced decision to refuse treatment. So that might formulate part of the care plan. It's really important, and I'm so pleased to have this opportunity to talk, because your nurses will be discharged, people listening to this will be discharging patients home, potentially to die as well, or caring for people in hospital. So part of a plan will be thinking about symptom management, potentially including crisis medications, and maybe just in case medications, crisis medications, because if somebody has been controlled on oral morphine What are we going to do when they can't swallow? And alongside those crisis medications, we need to have a chart in place. So these would be forming part of a plan.
Yeah.
Incredibly important, Carol, is an emergency plan. And again, I can't tell you a specific plan that people will use because it varies over the country.
Yeah, of course. Yeah.
Quite often, you'll be familiar with the respect document.
Yeah.
That does contain wishes and preferences and what a person wishes to do in that emergency situation. You may hear other documents used across the country. You may hear TEP, treatment escalation plan, an anticipatory plan. It doesn't matter as long as somewhere there is documented. What are we going to do if? What are we going to do if this person's temperature spikes? What are we going to do if they develop another chest infection? And does that mean taking somebody to hospital, giving oral antibiotics, or giving intravenous antibiotics? And having that plan, we need to think about cross-boundary working. And if you're discharging a patient, what do you need to tell the next person that is caring for them? So does that help answer 3 elements of advanced care planning? And when we get to that very later stages of life, the last thing that we've been talking about, really important then to focus, to ask, to find out, how do I translate this information locally? What is my local advanced care plan that I can put this rich, powerful and important personalised information on to share with colleagues so the patient doesn't have to repeat again and again? And gosh, I'd love to sit here and say that the system is perfect, but the system isn't perfect. We don't have great interoperability and systems don't talk to each other. Part of my passion is, sorry, interrupt you, part of my passion is empowering the public to understand their role in advanced care planning, so they drive the journey as well.
Yeah, because I'm just thinking, you know, if this happens, where do we go in the trust, like a big NHS trust or a community trust, for example? We'd have leads for end of life care, I suppose. You know, I haven't thought about it myself. One issue, I suppose, is, and I know this from a family member, if you haven't got your lasting power of attorney, you haven't got mental capacity, you've got where do you what so a nurse in that situation, and they've got an individual that's saying, I want this, I want that, I don't want this, I don't want that. It makes it harder, doesn't it? Is there more of a team decision and you need a case conference maybe? I don't know if you want to just sort of say anything about that, those sort of more difficult. I know I didn't say I'd ask you this, but
we could go off on so many tangents. This leads to so many different
but I know that often happens. People haven't got that, and we've got patients that are getting more dependent and poorly are in hospitals, and they might not have capacity. I know it's got to be assessed on an individual basis at the time, but if they didn't, and the person felt, well, you know, they need to start thinking about advanced care planning.
So we're talking about a situation where a person has lost capacity to make a specific decision in a specific circumstance.
Yeah.
I'm going to keep bouncing out to podcasts as well, because I've got great podcasts for people to listen to about capacity and really drilling into this.
Brilliant.
And it's called Capacity is Not a Binary Subject, and it's with Dr. Maggie Keeble.
Brilliant.
Really recommend that to reflect on advanced care. Reflect on mental capacity. Because we fall into the trap of saying somebody's got capacity or not got capacity and thinking it as a binary, you've got or you haven't got. Whereas in reality, and it's quite a mouthful, we have to say got capacity to make this decision in this circumstance.
Situation.
So just putting that as a little bit of background. So let's take the situation where somebody hasn't got capacity to make a certain healthcare decision. And just to reiterate that a next of kin does not have automatic right to speak for somebody, and I think that's what you're alluding to.
Because often they think they have. So, you know, some will come in and different people will have different relatives will have different views.
Yes, and I think this data tells us that 72% of people think next of kin has an automatic legal right to speak. But as you say, they absolutely don't. And as professionals, we need to be responsible for debunking that myth. So if somebody does not have capacity to make that specific decision, what I would be doing is to drill down and see, have they made any advanced statement of wishes and preferences? So have they documented anywhere what is important to them? When I created my advanced decision to refuse treatment, which is a legal document, I underpinned that by saying what mattered most to me in my life. So if anybody needed to speak for me, that helps them to make those decisions. So I've set out what brings me joy, what makes my life worth living, and that they're great things to write, really informally. Anyone listening to this, when we close, they can grab a piece of paper and just think, what makes my life worth living? What brings me joy? And that's the beginnings of an advanced statement. So first of all, find out if a person does have any form of informal advanced statement. We've already assumed from what you said that they don't have a lasting power of attorney. Find out if they've got an advanced decision to refuse treatment. So what you're discussing, they may well have refused at a point in time when they did have capacity. So do that little bit of digging around, do that bit of research. If we find a situation where somebody has not nominated somebody to speak for them, they haven't created an advanced decision to refuse treatment, and they haven't left any plans or any overview, then we'll be going to a formal best interest. And that is best interest. I'm talking about the Mental Capacity Act best interest, the formal best interest process. So a long answer, but it is, I think, important to really reflect on the complexities of this and the importance of planning. Because we don't want to be in that situation.
No, absolutely. And I'm almost thinking, Claire, you know, we have hospital passports for patients, and you know, especially in the UK, we don't talk about those long-term decisions. And I know in some countries, from when you're very young, from 18, they will, I can't remember if it's Sweden or Norway or somewhere, but they on their hospital documentation or their own records, they document this, their preferences, their likes, their wishes, donation, everything early on. So it's almost like, do we need to have those conversations like you're saying, and the work that you're doing is really highlighting this issues for everybody, you know, so thank you so much for highlighting it. Now, we also, when we met before, we talked about your model of advanced care planning, or would you talk through just the model of advanced care planning at all for me?
Yes, I will. And just to reiterate, this is something that I've developed. This isn't a national framework. This is something that I offer as a way of, we've spoken so far about all these different threads and elements and components of advanced care planning. And I created this because every trust I've worked in, every area of healthcare I've worked in, I've done the same thing. I've educated, I've created documents, and I thought, this is crazy. I'm just saying the same thing again to different areas. We need to have a broad understanding of what it is so that we can all understand it and do it, no matter what your local documents are. So that was the thinking behind it. It took me a couple of years to come up with it, and then I had my eureka moment. You'll probably see my hands try and articulate this.
Yes, that's okay.
To try and draw it. And I'm also going to point listeners to, I've written a blog about this as well, called Getting Your House in Order, and that's part of conversations about advanced care planning. So I'm going to paint a picture with words now. So the model is very much based on the foundations of what matters most to a person, because like a house, it has to be built on firm foundations. Advanced care planning has to be built on a foundation of what matters most to a person. And that's what we were speaking about a few moments ago, wasn't it?
Yes.
What matters most to me is living long enough to see my daughter do X, Y, or Z. Or maybe what matters most to me is living less length of time, but in a better quality of time.
Yes.
So those foundations is what we're going to build our house of care planning on. So I'm then going to draw you some windows in our house. So the first window that we would think about exploring is, apologise, that's reminding me that I need to talk with you this morning.
Oh, don't worry, you can't see it on screen, so don't worry.
Excellent. The first window that I would like to draw is what you do want. So thinking about the things that you do want, and locally, that could be translated into an advanced statement of wishes and preferences. But just casually, what you do want is behind that first window. I'm going to draw you another window, and that is called what you don't want. And I referred earlier to some legalities of advanced care planning. If somebody says, I don't want that, that translates into an advanced decision to refuse treatment. So think about what you do want, what you don't want. So we've peeked through two windows so far. And this is a very childlike drawing as well. So in my bottom,
I love it because it's practical and simple.
It's so practical. I'm a practical soul, and this works. I've used it time and time again in teachings, and it works. The next window to think about in advanced care planning is who will speak for you. And that comes back to what we've been talking about for lasting power of attorney. So that is a component or a window of advanced care planning. And if I'm doing this as a teaching, it's brilliant because I can draw the model and then we can jump into each window and really dive into what advanced decisions to refuse treatment is, what lasting power of attorney is. So we've got what you do want, what you don't want, who would speak for you, and then the last big window that I draw, it's all about your legacy, creating a legacy. And that could be anything, couldn't it? It could be thinking about a will. It could be thinking about organ donation. How many times in your nursing career, Carol, has somebody said to you, I want to donate my body?
Yeah.
And do we always know what to do if somebody says that, if they want to leave that legacy? So strangely, one of the podcasts is about donating your body for medical education.
Yeah.
So an important component of advanced care planning is thinking
Yes.
about a legacy. It could be towards the later stages of life as something as beautiful as doing hand cast models with somebody. Very, very early in my career, I remember taking something as simple, and this shows how old I am, I'm afraid, an ink pad and taking fingerprints of somebody who wanted their fingerprints. I've gone goosebumps telling you that because I can remember doing it. So taking a handprint on an ink on the ward clerk's ink pad and preserving that as a memory for the family. It could be writing letters to the future. Thinking about legacy, something people do not think about is a digital legacy. Now, how many people have got photos on their phone? How many people have got photos in the cloud? A Twitter or an X account, a YouTube account. I'm going to challenge you. What would happen to your brilliant YouTube account, Carol, if something happened to you?
Yeah.
And
you don't think of those things,
you
do
don't
you,
think
Claire?
about it.
No,
and I've fallen
so
into that trap. If something happened to you, sorry, not when something happens to you.
Yeah. So interesting.
So thinking about digital legacy, in my will, I've drafted money aside to maintain a website because it's my life's work and important to me.
Oh, it's amazing, Claire.
So,
is there people that can do that for you? I'm so sorry to interrupt you. I'll forget to ask you otherwise in my brain. It's so with digital it's like a digital repository. I think I've seen companies doing it, but is there things that you can do free, or do you have to pay, or do you just set them up yourself? Or
great question. So the best advice that I can give you is to recommend people look at the Digital Legacy Association website and work by James Norris. I've also had the absolute pleasure of interviewing James Norris, Creating Your Digital Legacy with James Norris on the Conversations About Advanced Care Planning podcast. And the website has got information for Twitter or X, for Facebook, for all the different elements as well. Thinking about your bank accounts, all of that. So that would be my best advice. So I hope this is articulating. We've gone through 4 windows. There's one more window that I'm going to go through, if you like, or just identify. So the house I'm drawing, built on a foundation of what matters most, thinking about what you do want, what you don't want, who would speak for you, and your legacy, including that digital legacy, which I would argue everybody listening today has a digital footprint.
Yeah.
The final window that I talk about and explain is end of life care, Carol.
Yeah.
And it is just one window. It is just one component of advanced care planning. And we can break that down into the last year or years of life and what we were doing in the last years of life. We can then think in the last months of life and then think in the last days of life. So advanced care planning, that's the model that I draw. So if we visualize a house built on the foundations of what matters most, there's 4 windows I've described: what you do want, you don't want, who would speak for you, your legacy, and that last window is end of life care. Because most of that advanced care planning, all of those other windows we will have tapped on, I hope, before end of life care, because by then it's too late.
Yeah.
And the final imagery on the infographic that I draw is the sun and the rain. So this is all hoping for the sunny days, but being prepared for when it rains. So just a simple infographic, which I hope I offer and I hope helps people.
And I think that is so amazing, Claire, listening to you, because I always think of end of life and what you're increasing that awareness of all the other different elements.
Absolutely.
And I love the whole. So where would we see that visual? So that visual, I take it's copyright. Have you copyrighted it? You should have done if you have to.
Yes, it's mine.
so nationally, that would be brilliant to share. But where would students or newly registered nurses that watch the channel be able to see the visual and then maybe put it in an assignment and they can copyright your name and stuff? Where is it on your website?
It is on my website, and
Yeah.
I do need to update it because as my skills improve, that the image has got better over time as well.
Yeah.
The basic image stays, but it's got better. It's on my website, it's on a blog, and I think as a result of this, Carol, I'm going to put it as a standalone as well. So on the resource section, by the end of today, it will be a standalone.
Yeah. And have you published it?
Not formally, no.
So it would be really good if, say, one of the journals out there, like the Nursing Times or something, if you could put it on, like get it published as well, would be amazing, wouldn't it? Because then it'd be a reference as well.
I hadn't thought about that. It was.
But I mean, it is published. If you put you have to put a copyright thing under the visual, don't you? Like a C or something. I don't know how it works, but then people can't sort of just take it. But I think it's such a simple idea. But for teaching purposes, and I would suggest you get it published, Claire.
Oh, I'll add it to the list.
Add it to the list, yeah. Because I think it's just a really you know, you've imparted all that information really simply as well, which is fantastic. So my final question is, what are the three, because I don't want to hold you up much longer, what are the three most important things that you would recommend for advanced care planning? So if you just leave the readers with the sort of three.
Okay. Firstly, I would say find out quite simply what matters most to a person and let that lead and direct advanced care planning, because it will so beautifully. Secondly, find out what is in your area, what forms, what processes, and how you share information across boundaries. And thirdly, this is for everybody, so just don't leave it too late.
So thank you so much, Claire. You're an amazing resource and got such experience, and I really appreciate you sharing your knowledge and skills with our viewers. If you have any questions for Claire, she's really happy to answer them. She might even do another video for us. We could see what people suggest. And if you enjoyed this talk, Claire, you could support Claire with her Buy Me a Coffee website, isn't it? Because all of this work you do for, you know, yourself, don't you? Because you're passionate about it, but and it helps her to create more content. But if people have got questions, go on Claire's website, join the website. You can subscribe, I take it, to the website and have access to the resources. Is there anything else you want to say, or I think we've covered most of it, haven't we?
Thank you for this opportunity, and I can expand and jump into any of those windows in any detail if your listeners would like that.
Yeah, I think just to highlight again, because you've mentioned about so many excellent episodes for your podcast. The podcast is called Conversations About Advanced Care Planning, and you're the founder of Speak for Me. And what is the website name? Is it your name, Claire Fuller?
It's www.
Oh, we can't say it. We can't. Sorry, no, we're not allowed. We're not allowed to give a web link because it takes people off YouTube. Right. Just before you say, but what's the name? What's the name of it? Yeah,
I'm trying to think how to do this. Then it's called Speak for Me.
Yeah, so if you could put Speak for Me and put Claire Fuller in, you'll get your website, won't you?
Speak for Me will get the website. I'm trying to do this really cautiously now. Yeah, Speak for Me will get you there.
Yeah, don't worry, loads of people do it, and then I can't upload the video, you see. You can't put state or put sort of online links because YouTube don't like you you can put stuff in the description, but only stuff linked to the author of the video, sort of thing. It's, you know, they're really strict on the rules. So, but I'm sure people will gain some amazing resources with your podcast and your website. So thank you so much for your time, Claire. And I've learnt loads today as well. So have a good rest of your day.
Thank you. And thank you for the invitation, Carol. It's a joy to talk about something I care so deeply about. Thank you.
Oh, thank you.